Good afternoon, I'm Dr. Cheryl Olson from Surgical Associates of La Jolla, California. Today I wanted to talk a little bit about hernias and how they occur and how to know if you have one. Hernias happen in and around the abdomen, typically from a natural opening that allows vessels or various structures to traverse the abdominal wall, or in the case of the diaphragm, the esophagus comes through the diaphragm. So normally those openings are snug and tight, but over time those can dilate and you get a little sac pushing through that opening, which becomes the hernia sac, and then other body tissues, say fat or intestine, can get through those openings. And over time that can get bigger and bigger and also cause discomfort, pain, mostly. That's the most common symptom of a hernia. But as they develop and get bigger, when they contain intestine, then they can cause some terrible complications such as a bowel obstruction or even in dead bowel, so ischemic bowel. So typically if you have a hernia, we talk about are there symptoms and when should we fix it. So typically patients in otherwise good health, we would advocate fixing those early. Hernias will not go away on their own, and they can't repair themselves, so they do need to be surgically repaired, but sometimes the timing is not urgent. We can put it off, and most of the time I say, look, if it's not hurting you and it's very small, you don't really have to do anything about it. You can just keep an eye on it. But if it starts to cause you pain, or if it's getting larger, then that's the time to talk to your doctor about getting a referral to a surgeon to then repair that hernia. Diaphragmatic hernias occur where the esophagus joins the stomach, and what can happen is that gradually gets larger over time and your stomach slides up into the chest. It's called a hiatal hernia, and that can be a pretty serious problem because it can cause reflux like heartburn, and it can cause some symptoms that don't allow you to swallow normally. Feel like things are getting caught up there, and so that requires a different kind of operation to fix that. But that's just another type of hernia. The other more common types of hernias are inguinal hernias that happen down in the groin, and those can be a little bit more complex in their reference names. We talk about an inguinal hernia that's either an indirect, where it followed that natural opening. In men, the spermatic vessels go through there. In women, a round ligament goes through. But as we age, we can get deterioration of the tissue in that very area and actually have like a blowout. So the tissue disintegrates and you actually get a hole that wasn't supposed to be there. And then you have the same process occur where the sac pushes out and fatty tissue, maybe the bladder, maybe part of your colon, comes out through that opening and causes discomfort, can cause difficulty having bowel movements, can cause some difficulty urinating, and so those can be difficult problems and very symptomatic. Again, we have to look at your overall health in terms of should we fix this, when should we fix it, does it require that we stop medications that you're on such as Eliquis or other blood thinners, and so we have to look at, is it safe to stop those medications in order to fix this hernia? And sometimes we say, well, this patient is not a good surgical candidate, and then we would say, well, we'll do other treatment, which is non-operative treatment, have you wear a truss. Generally speaking, people who are up, around, active, and living their life typically would prefer to get their hernia fixed rather than have to have symptoms long term. Typically we repair hernias with mesh. A mesh is a screen-like material, a polypropylene or nylon, if you will, that helps the scar tissue to be stronger. Without the mesh, we have only your body's tissues to repair the hernia with, and then it can break apart. So the sutures either pull through or the tissue redilates and you get a recurrence. So recurrence rates are much higher when we don't use mesh. So my typical preference is to use mesh with any kind of a hernia repair to try to make it stronger and avoid the issue of a recurrence. There is some controversy and concern about the mesh we use. Some mesh has been recalled. Most of the mesh we're using nowadays is totally safe. I would have it put in myself, and so typically I think of that as I go through the discussion with patients about pros and cons of mesh, and I think mesh is a safe thing to use, at least with the meshes that we use in our practice and the methods that we use to place them.